Hi, everyone. We'll be getting started shortly. Please share your name and where you are joining us from in the chat box. All right, welcome everyone. Thank you for joining today's webinar, Competencies in Focus, Internal Communication. My name is Kellen Schalter, and I'm a Senior Manager with CADCA's Public Health Programs team. CADCA, in partnership with the Center for Public Health System Science at Washington University in St. Louis, is excited to present today's webinar, which is our fourth webinar in our 18-part webinar series at CADCA's Coalition Competencies. Next slide. Perfect. Thank you, Laura. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with the tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed approach to technical assistance, we help build your capacity to implement best practices that improve community health outcomes. To explore more about our work and subscribe to our weekly newsletter, please visit cadca.org. Next slide. So I'm sure by now everyone's familiar with Zoom, but I'd like to go over just a few housekeeping notes. First, all participants are muted by default, so for general comments, please use the chat box like you are now. Second, we'll have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please be sure to use the Q&A box. And third, you will receive a post-webinar email with the recording of the webinar slides and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. Next slide. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Zara Petkovic from the Center for Public Health System Science at Washington University in St. Louis. Zara is a project coordinator for research translation projects, which includes the Best Practice User Guides, a series of publications designed to help states implement effective tobacco control programs and policies. She was involved in producing all aspects of the guides, including research, writing, and editing. Her interests include public policy and community-based interventions. We are also joined by Laura Brossart, the Assistant Director for Communications and Dissemination at CPHSS. She oversees CPHSS internal and external communications and the design and dissemination of center evaluation and research products. Laura serves as dissemination lead for the Translational Science Benefits Model Project, served as a co-investigator on the long-running CDC-funded User Guide project, and managed the dissemination and implementation core for the NCI-funded Advancing Science and Practice in the Retail Environment project. Last, we are joined by Maggie Mahoney. Maggie provides expertise to inform policy strategies throughout the U.S. that reduce tobacco use, exposure to secondhand smoke, and differences in health outcomes related to tobacco use. She has worked in this field since 2006, providing support to health organizations and government agencies at the local, state, and federal levels. Maggie was the recipient of the 2015 C. Everett Koop Unsung Heroes Award for her contributions in tobacco control. Thank you all for joining us today, and Zara, I'll pass it to you.
Yes, so thank you again all for joining us this morning or afternoon. It's afternoon here too. I don't know why I said that. Our goals for the webinar today is first, I'm going to briefly review the background and purpose of the CADCA Coalition Competencies. I'll introduce the internal communication competency, And then I'll pass it over to Laura and Maggie, and we'll learn some insights on internal communication from the Aspire project. And finally, you'll learn a little bit about internal communication support offered by CADCA. Next slide. Next slide. And so as you may know, the CADCA Coalition competencies cover 3 domains: operations, community, and prevention, that are essential to effective coalition work. Next slide. And the competencies were developed through a 4-step process, which is one recommended by the Federal Employment and Training Administration for competency models. First, to gather background information, to develop a draft model, gather expert feedback, and refine the model. And we follow this approach to develop the CADCA Coalition competencies. So first, we gathered background information on key topics in coalition work. This involved conducting a systematic search and review of the literature on coalitions, and we also interviewed coalition experts in the US, South America, Asia, and Africa. And we used what we had found to develop a draft model, identifying the 3 domains and competencies, including their definitions, evidence, and knowledge, skills, and abilities needed to develop each competency. And the initial draft of the competencies was then reviewed by coalition leaders and CADCA staff from a variety of backgrounds. And using their feedback, we revised the competencies and they were reviewed again before being finalized. Next slide. So now I'll talk a little bit more about the specific competency that we're here for today: internal communication. Next slide. So the internal communication competency is part of the operations domain, which is about the elements of infrastructure necessary for the sort of basic forming and operation of a coalition. Next slide. And this is a preview of the single-page PDF that just has the internal communication competency. And I believe you will get this after the webinar. Next slide. So what is internal communication? And now I'm going to walk through basically everything that was previewed on the previous slide. Next slide. So we define internal communication in the competency as effectively communicating among members to manage coalition work, make decisions, and achieve shared goals. Next slide. And next, why internal communication? So the evidence on why internal communication is important for coalitions. Next slide. We found in our research that internal communication fosters innovation, strengthens collaboration, and contributes to a positive climate. It enhances member satisfaction and engagement, increases coalition sustainability, and strengthens collaboration. And finally, internal communications is linked to stronger coalition team building, planning, and goal achievement, and it helps build trust among coalition members. And this is based on 17 resources that we reviewed on internal communication specifically. Next slide. And now I'll talk about a little bit about the knowledge, skills, and abilities that we found were essential to developing competence in internal communication. Next slide. So the knowledge that's important for internal communication is first group dynamics. So knowing about different communication styles and how to work effectively in groups and what may be suited for different kinds of groups. And second, knowledge of the specific members of your coalition. So they're including their role that the organizations play in the community and the role that they specifically play in their coalition, any communication preferences that they might have or channels that they use, things like that. Next slide. And then the skills that we found in the research were essential for internal communication are, of course, effective communication, which is really has an emphasis on communicating consistently and practicing active listening. So not just communicating one way, but communicating both ways with your coalition members. And the next skill is coalition management, which is really developing systems to support communication. And then communication of vision, goals and objectives to your coalition members, partners, and other decision makers. And then meeting facilitation, so leading effective meetings, producing and disseminating agendas, maintaining focus in meetings, and making decisions. And finally, We have group decision making, so building consensus, negotiating outcomes that can satisfy everyone as much as possible, and solving problems as a group. Next slide. And then finally, we have abilities, with the first of which is trust. As I mentioned a couple of times already, it's really important to have the ability to create trust and cohesion through open communication, again, active listening, mutual respect, and transparency. The second ability is openness to ideas, which is the ability to welcome a range of different perspectives, communicate values and goals, and foster innovation with a wide variety of partners. And then power sharing, which is the ability to share decision making among members. And then finally, conflict management, which is the ability to identify, recognize, and manage conflict with creative and effective solutions. Next slide. And so now I'm going to pass it over to Laura to talk a little bit about internal communication and Aspire.
Okay, thanks, Zara. Good afternoon, everyone. I'm glad to be with you all today. I'm Laura Brossart, and Zara and I are here representing the Center for Public Health System Science at the newly launched School of Public Health at WashU in St. Louis. Our center's mission is to change systems to create healthier communities through research, evaluation, and translation. And we use a range of innovative methods and strategies in 3 core focus areas. So the first is policy and prevention. So reducing the harmful effects of chronic disease through development, dissemination, and implementation of public health prevention policies. The second bucket is dissemination and implementation. So sharing and implementing the results of public health science effectively in healthcare settings, communities, and states. And finally, system science, where we study the complex nature of systems using new methodologies such as social network analysis, agent-based modeling, and system dynamics. We're very excited to be continuing our partnership with CADCA on the core competencies work. And today I'll be sharing an example of internal communications that comes from our work with the Aspire Center. I'll start with some general background on the Aspire Center to help orient you to the project. The Aspire, or Advancing Science and Practice in the Retail Environment project, started in 2019 and wrapped up earlier this year. It was a 5-year NCI-funded collaborative of tobacco control researchers, practitioners, and legal experts working to fill gaps in the evidence about how different aspects of the retail environment, like retailer density, for example, affect tobacco use and disease, to explore the potential of different retail policies to raise the cost of tobacco products, reduce tobacco use, and increase cessation, especially for populations with the highest rates of tobacco use, and to help communities implement scientifically sound, legally defensible, and practically feasible retail policies in retail settings by translating and sharing evidence about what works. We recently submitted a proposal to renew this work for another 5 years, so we're very hopeful to be able to continue this project in 2026. The Aspire Center includes research teams and projects from 3 universities: Stanford, which houses the Big City Tobacco Control Project; UNC, which leads the Retailer Density and Disease Project and houses the Administrative Core; and our center at WashU, which houses the Tobacco Town Project and the Dissemination and Implementation, or D&I Core. The example I'll be talking about today was part of the D&I Core, whose goal was to enhance the accessibility, reach, and impact of Aspire research by developing and disseminating translational products and resources. I'm going to share about one of the very special aspects of our Aspire Center, and that is the Community Advisory Board. Our Community Advisory Board, or CAB, was comprised of 1 representative from each of these 30 large U.S. cities. Collectively, these cities represent more than 15% of adults in the U.S. Most of the representatives worked in leadership roles in their city or county health departments. The cities vary with respect to state and local tobacco control policies and region. So these folks really help us get a picture of what's going on across the country. Because CAB members are on the ground, directly engaged in prevention and policy work, and many times even communicating with policymakers, they know best what research and materials are needed to advance retail policy work. While a community advisory board is not exactly the same as a community coalition, the 2 do share some similarities, including the fact that both involve participation of community members, ensuring that diverse voices and perspectives are included, They both foster collaboration among various partners like individuals, organizations, and government bodies. They both identify and address community needs and issues. And also members of both serve in an advisory role, so providing insights, guidance, and recommendations to influence programs, policies, or initiatives. In addition to the 30 big city representatives, our board included one rep from each of these organizations who brought legal and advocacy expertise to the group. On the right is our CAB chair, Maggie Mahoney, who you'll hear from in a few minutes. She was the liaison between our research teams and the CAB, and also our retail policy expert on the project. So now that I've shared a brief overview of Aspire, I'll talk more specifically about our internal communication strategy working with the CAB. I'll cover the channels we use to communicate with the CAB, our internal engagement process, what we learned about the CAB's preferences and needs, and how we adapted and created products based on CAB feedback. Through the Aspire example, we'll be covering several of CADCA's internal communication KSAs, including the knowledge KSA of coalition members, the skills KSAs of effective communication, coalition management, and meeting facilitation, and the abilities KSAs of trust and openness to ideas. So we think communicating through multiple channels, including in-person and virtual meetings and regular email communications, was really important for the effectiveness of the communication and for trust building with the CAB. I'll start by sharing about our annual convenings that were held from 2019 to 2023. So each year we hosted a 1.5-day in-person convening. We hosted this meeting in person at the beginning and end of the 5-year period, but in 2020 and 2021 during COVID, we hosted the meeting virtually. These meetings provided opportunities for networking, learning, and collaboration among attendees, which included all 42 CAB members and also members of our 3 university research teams. We accomplished a few different things at these meetings. The Aspire research projects presented their latest research findings to help keep the CAB members informed about ongoing scientific developments and project progress. The D&I course shared translational products. So these were resources that we specifically developed for use by our community advisory board members. And the CAB members were then encouraged to share these products with policymakers to influence community health policies. CAB members also shared their successes with researchers and with fellow CAB members. And this was a really important part of the convening that fostered an environment of mutual support and also knowledge exchange. So we also used various interactivity strategies, including live polling throughout the meeting to solicit real-time feedback from attendees to really ensure that their voices were heard and considered in the discussions. These annual convenings were crucial for maintaining engagement, sharing knowledge, and strategizing for upcoming initiatives. And here's a picture from our last in-person CAB meeting in San Diego in 2023. So next I'll talk about our interactive community advisory board webinars. So these kind of supplemented our annual in-person meetings. We held these webinars twice yearly using Zoom to connect all CAB members and the research team. The Zoom format allowed for easy participation from members regardless of their location. During these calls, we were able to welcome and introduce new CAB members. This helped us to integrate new participants into our community and ensure that everyone was acquainted with one another. We actively gathered feedback from CAB members on research products during these webinars. And this input was really invaluable for refining and improving our research products and making them more relevant and impactful. CAB members also shared their own challenges and successes during these calls, and these discussions were a platform for peer learning and support and really encouraged collaborative problem solving. I think our interactive webinars were essential for maintaining ongoing communication, fostering that sense of community, and ensuring that we stayed aligned with CAB members' needs and experiences. Next, I'll share about our Aspire e-news initiative. This was a key communication tool for keeping our CAB members informed and engaged. So we sent the e-news out every 2 months, and it was delivered not only to CAB members, but also to the broader tobacco prevention community. And over the past 5 years, we delivered this newsletter 28 times. We had three main components in terms of content. The first was a direct message to CAB members. So each issue had a direct message. And we think that personalized communication helped foster a sense of belonging and helped keep members updated on relevant developments. We also developed and shared concise summaries of Aspire research findings. These summaries were designed to keep everyone informed about the latest insights and progress in our Aspire project, but also related projects at other institutions. The newsletter also shares timely news and useful resources. This could include information on upcoming events or conferences, new studies, policy updates, and other relevant materials. So I think the e-news was really instrumental for ensuring continued engagement and frequent information flow. And it also served as a reliable source for updates and resources that supported and enhanced our collective efforts. Next, I'll talk about the Aspire website. So this was an informational website that was dedicated to the Aspire Center. We launched it in April of 2020, and it served as a comprehensive resource hub for our community and for stakeholders. It is still active now. The website houses all of our research products and the retail policy resources that we've curated and shared. It was managed by our D&I core team so that we could ensure that the content was up to date and relevant. In terms of usage statistics, between April 2020 and March 2025, the website received 95,000 page views and attracted 234,000 users. So these numbers really highlight, I think, the website's value and its role in disseminating critical information to a wide audience. Next, I'll talk about the lessons learned from developing and promoting the My Aspire private message board portal. So we launched this portal alongside the Aspire website in 2020. We designed it to be very user-friendly and to be a private space where CAB members could communicate with one another and share resources. We added all of the community advisory board members, invited them to use it. And we also actively promoted the portal through various channels, including emails to CAB members, announcements on our webinars, and mentions in our bi-monthly e-newsletters. And we continued to promote it for quite a while, probably up to a year or so. And despite these efforts, we never achieved significant uptake or engagement with the portal. And I think, we learned some things from this. We learned that it's really hard to get people to use a new platform to communicate, even if they've expressed interest in having, such a thing. Our CAB members are very busy professionals with demanding roles. And even though we saw a clear benefit to engagement with the portal, ultimately we were asking people to do one more thing in addition to their regular jobs. So I think understanding preferred communication and interaction methods for the community you're working with and figuring out how to tap into existing systems and networks is really important. While the portal itself did not meet our expectations, I think developing and promoting it did give us valuable insights into how we can better engage and support our CAB members in the future. So communicating with the CAB, the channels. Now I'm going to switch from the what to sort of the how and talk about the process of engaging with and communicating with CAB members. So the first step in the process for us was to understand the preferences of our audience, and in this case, our CAB members. So we think of our audience as extending beyond the CAB members themselves because they represent tobacco control practitioners broadly, and many of them do have access to policymakers and other decision makers. Step 2 was to create products and communications. So because we ask our CAB members about their preferences for topic, type, audience, and frequency, we're able to tailor the materials we make to their needs. Step 3 was to evaluate the use of materials through a variety of methods, including 2 rounds of interviews over the 5-year project, live polling at virtual and in-person meetings, email and website metrics collection and analysis, and also through less formal feedback via meetings and emails. Beyond the interviews, one of our favorite ways to collect information quickly is through live polling. It's fast, it's cheap, meeting attendees seem to like it, it's a good way to break up meetings, and it's a way to make sure that everyone's responses are captured. So here's an example of one of our polling questions on communication channels. We found that CAB members preferred email or webinars over other channels to hear about new retail policy resources, and almost 50% preferred an update once a month. So the response to this question informed the design of our Aspire e-news product, which goes out every 2 months to CAB members, or went out rather. Another poll result about format types told us that our audience favored fact sheets, case studies, and policy briefs over longer formats like reports and articles. So this helped inform our choice in terms of the type of products we would create. And we also asked about sharing as well. So who will you plan to share the requested products with? And CAB members told us they intended to share the materials with city council members, community members, and department staff. And this information helped us develop products for the right audiences. So we took the information collected through polling and other means, and the D&I Corps worked with the 3 research teams to plan and prioritize evidence-based translational products. Translational products are documents or visuals or interactive dashboards that are primarily designed for practitioner audiences, so not for researchers. All of the products on this slide are what we call city-specific. In other words, we created a tailored product for each one of the 30 CAB cities with data specific to their community. The role of the D&I Corps depended on the product. So for example, the fact sheet pictured on the left, for that fact sheet, the Stanford research team collected the data and did the research, and we handled the design, translation, and dissemination. The middle product represents a collaboration with the Campaign for Tobacco-Free Kids. And for the Tobacco Swamps interactive dashboard on the right, the Tobacco Town project team developed the dashboard, and we helped with sharing and promotion. Here are some of the other products we created. On the left is an Aspire Year in Review, which we published annually, highlighting tobacco policies passed in and around our 30 big cities and summarizing all of the research and translational products published over the year. And the 2 products on the right are packaged brief reports about retail policy progress in our 30 cities. So reporting back to our CAB about what we heard from them through the interviews. And these were designed for them, but also for the broader tobacco control community. And they covered a number of topics related to tobacco retail policy. So after we publish the products or support their dissemination, we want to evaluate their use. So one way we did that was to ask the audience who they shared the materials with. And in this case, our CAB members said they shared materials with department staff, community members, and policymakers. We also asked about whether they used the products we shared. We asked others more specific questions as well, and we used the information gathered to inform our next steps. It's important to note that these 3 steps of our process are sequential, but they're also iterative. So we repeated them with new information, new product development, and new evaluation continuously over the course of the 5 years. Finally, I wanted to share some specific feedback we got on the products. The first 3 get at the sharing piece. So who did the CAB members share the products with? And I love the enthusiasm in the first one where they shared about how the information was timely and would be useful in their legislative session. So yeah, this brings me to my last slide, where I'm going to hand off to our CAB chair and our wonderful colleague Maggie Mahoney. Maggie was our liaison between our research teams and our CAB members, helping us share what the researchers were working on and fielding requests and guidance from CAB members. She was also our resident retail policy and legal expert, so helping our research team and CAB group stay informed about important policy updates. She planned agendas for and facilitated the in-person meetings and the virtual webinars. So I think, you know, in a lot of ways, she was the glue that connected everyone in the Aspire work, which makes her a critical element of our internal communication. So here's Maggie.
Great. Thank you, Laura. And hello, everybody. Thank you for inviting me to be here today. I don't have slides. I just have some informal comments to share um, and thoughts based on um, working with the CAB. And I see a question in the chat box right now that I'm going to answer at the end of when I'm speaking. So I will, if I forget, somebody remind me. But I was going to say that for the Community Advisory Board, in working on this project, it really it was something that I was doing above and beyond my regular full-time job. And the reason why I did it is because it is something that was so meaningful and rewarding to do in terms of really working with great researchers, but then also working with practitioners and really finding that connection and helping enable that. And while the success of our project was dependent on the work that Laura and her colleagues did, Laura and Zara, in terms of kind of the technical expertise and getting information out to the field. I also want to just express that the researchers themselves that were doing the research, they had before this project and in all of the work that they do, they have a very strong commitment to making their research accessible and helpful for the field, and really respecting the CAB members and their time. And so I think that that's something that is translatable to any group of people who are working together, is that even if you have the conveners who have this goal, and so here you had researchers who got research funding, they were very committed to working with this group of people and really respecting their time, making sure that things are understandable and things like that. One thing that was also pretty unique about this project, and this goes back to those knowledge, skills, and abilities, is they really embraced group decision making for the work that they were doing. And this came up in two different ways. So with the research, when they put in their research grant, they had to say what they would be studying broadly and how they would achieve that. But when it came down to the nitty-gritty, they were able to come to the Community Advisory Board in those in-person meetings, in the calls that we had. And we used live polling for some of this, actually, was letting people know, like, okay, this is generally what we're studying. What are the very specific angles, or what specific aspects would be helpful to you in your work? And so then the researchers would tailor their research to help meet the needs of the Community Advisory Board, who are the people out in the field and the practitioners. They also, when they were working to develop those very beautiful fact sheets and infographics and things like that, they would sometimes pull together a group of some of the Community Advisory Board members who they knew would be using the materials to get their input on, is this too much information for decision makers in your community? How should we package this in a way that that is useful to you in your work? And so that was all taken into consideration. The researchers, while they have to and want to write journal articles to talk about the research that they're doing, they really prioritized having practical materials for the field. The one thing that I think was helpful, that is good for any sort of group that's working together, is that there was kind of a willingness to go beyond the standard scope of why they were originally meeting. I mean, they have these research goals, and they're going to go do this research to achieve it and disseminate the research findings. But when we had our in-person meetings and we were developing the agendas, we had ideas of what we thought the CAB would want to talk about, but we also solicited feedback from the CAB to see what the burning issues were that they were dealing with. And even if we didn't have the expertise to help address those things, there were people in the room who had lived experience that would be able to help provide this peer-to-peer connection. We also built in a lot of time for informal networking when we had our meetings, so that it wasn't just a super rigid time frame, but people had time to share information with each other. We had events and things like that, like dinners and things like that too, where people could engage. The thing that I think really speaks to the success of this project is that as Laura explained, the work has largely wound down, but we're still getting messages from people out in the field, people from our community advisory board, or people who are seeing the resources on the website who have questions about how they can do something similar, or do we have any information about research studies and things like that that are helpful to them in their work. And so those are questions that I'm still helping respond to, even though we're not in the thick of what we were doing. The only other thing I was going to say, I think, is, oh, there were two things. One is that and sorry, this isn't super linear. Two things plus responding to that question. One is that Laura talked about the e-news and so this kind of goes to meeting people where they are. In the e-news, while we promoted journal articles from our researchers and things like that, and accomplishments from our CAB cities, the e-news also dealt with other topics of interest to the general tobacco control community. And so that helped make it a extra helpful resource for the field, so that they know about other things going on that was relevant to them in their work. And then inevitably, over the period of this research project, people move from one job to another. And so we'd always find out whenever we'd send out an email blast to people that community members had changed. Some people would let us know in advance, like, I'm moving on, here's my replacement. But a lot of times, since this is a minor obligation for them, this is something that people didn't necessarily have on the top of their list to take care of before they went to a different job. And so we'd have to recruit new members, and I would explain to them what I would get out of, like, what I got out of the being part of the CAB and being the CAB chair, but also just helping them understand that the obligation was pretty low for them, but that the return on the investment would be huge in terms of what they would get out of the research. And nobody ever quit our CAB saying, this is too burdensome, it's not really helpful, or anything like that. And we had people who would move from one job to the next and say, can I still be on the CAB, or can I get your emails? And so I think that really speaks to the success of it. Laura said that we have put in a renewal application to continue the work of Aspire. And to answer the question that's in the chat about tribal representation, we've, in the proposal for the next phase of this project, we're trying to build in more tribal and more rural communities into our community advisory board, so that we have we have a fuller range of perspectives, and that we're disseminating to a broader group of people. So those are just some thoughts, but happy to answer any questions that anybody has.
Thank you, Laura and Zara and Maggie. Laura, can you go to the next slide? And then we'll start Q&A. Okay, so before we dive into Q&A, just a quick note from CADCA. You all might be wondering, how can I increase my coalition's knowledge, skills, and abilities in internal communication, and some of the things the presenters just spoke about. Next slide, please, Laura. So here at CADCA, we focus on this crucial competency during our National Leadership Forum and our Mid-Year Training Institute, which is coming up next month, and through various other coalition services and training programs. And additionally, internal communication is covered in our National Coalition Academy. Next slide. So as you can see on this slide, internal communication is covered in depth during week 1 of the NCA. So you can learn about effective internal communication through various CADCA offerings. Next slide. So while we're moving into our Q&A, I'm going to go ahead and I'll put the evaluation survey in the chat. And then if you go to the next slide, the QR code will be here on the screen as well. We kindly ask that you take a moment to complete the evaluation survey by either scanning the QR code or using the link in the chat. And please note that letters of attendance are given only upon completion of the evaluation survey. So moving to our Q&A box, it looks like our first question is, how do you get information about being on an advisory board in a rural area?
Thank you for the question. So we have identified a couple of communities that we're hoping to work with if the project is funded again. And part of that decision making was based on where have we, what are some states where we haven't had a CAB member before, so that we could broaden the reach to some different states. And also we wanted a couple of different rural, so we selected some communities that are two that are near each other at by a state border, so that we can compare some things between different states based on what the legal authority is in those two different jurisdictions and what the different uh, uh, landscape is like. So we do have communities that are already identified, but hopefully the resources that we're developing, if this is funded, will be useful to a broader group of rural communities. And then there was a question about how many CAB members were from each community. We had one official member, but then, like I said, a lot of people wanted to join or they'd have a backup. So we ended up having, for a lot of jurisdictions, we had several people, but we would only bring one person in person. But they could participate in all the calls and things like that. But we'd have like one main point of contact, but we'd include their colleagues, or since these were communities, some people maybe wanted the state health department to be engaged, and so we would include them as backup members as well.
Awesome, thank you, Maggie. Next question is, since the CAB representatives were across the country, how did the CAB decide what were the issues that resonated for all on the CAB?
Yeah, that's a good question, and I welcome Laura and Zara to weigh in as well. But the so like I said, we had research aims. So these major research goals that were that the National Cancer Institute said that they would fund us to do that research. And so we had kind of these broader goals. But then in terms of kind of prioritizing, we did some of that through like kind of the fine tuning of those issues. We would do that through polling the CAB members when we met with them to see where there was it wasn't always like the majority rule, but we would pick out like, where are some really good themes? Where did we think that we had the capacity to be most helpful? And so it was kind of a combination of factors that we used. But the nice thing is, like, our community advisory board, they were vocal. They would let you know if they had strong opinions or there was something that was really important for them. And we would try to listen for themes in what they were saying as well. So I don't know, Laura or Zara, if you have anything else on that.
Yeah, no, I think I'll just add that we also did, and this was built into the research study. We did a round of interviews in the second year of the project, no, in the first year of the project, and then again in the fourth. And those were in-depth Zoom interviews with all the big city CAB members. And we had a series of questions. And so it was really a survey of what was happening in retail policy in their communities. And so we did that in year one, and then we were able to, summarize and get that information back to the researchers, so that if there were connections between things that the CAB members really cared about and were focused on, and what the researchers were doing, those could be identified. And then we did it again in year 4. So I think those were really, really helpful information gathering points. We also extended the interviews to include a survey with one representative from each of the 50 states as well. So we also got some sort of state level information on retail policy work. So that was also part of the picture. So I think, and I think Maggie, mentioned the other important thing. Zara was actually, she was very involved in the interview. So I don't know if she has anything to add, but yeah, I think all of those pieces working together.
Yeah, and I can just add, since I participated in sort of scheduling the interviews, conducting the interviews, and then doing the analysis of the results. But even just from the interviews that I either conducted or took notes on, even before we started the analysis, it was like pretty clear that like there were like these top issues that people were having, that people were having similar barriers and similar facilitators and successes in different places, even though, a lot of the times like the political environment might be different, but um, a lot of the challenges were similar, just to sort of different extents in different places. So the themes sort of emerged on their own, I would say. There were more commonalities, I think, than differences in what people were interested in and needed resources on.
Yeah, and I think that just building off of that, Zara, I think um, granted we had mostly, we had 30 big cities, so you will have some commonalities perhaps, because the community types are a little bit more similar, but there were a lot of differences in terms of where people were in their, like what sort of authority they had to pass policies and what sort of political will there was in their jurisdictions too. But it still seemed there were big clumps of information and or priorities that were pretty similar. And then even when we had meetings, if people proposed topics that we couldn't cover in the meetings, we would send out resources and refer them to other people who maybe had more expertise than we did, to help them with their questions as well.
I have one question for you all, actually. So you've talked a lot about sort of like the open polling and taking preferences and things like that. And I think for a lot of the coalitions we work with, some of the first step is sort of like, how do I even, like, which internal communications do I start with? I heard you talk kind of about in-person meetings, Zoom, a newsletter, and also some of the trial and error and the lessons learned, Laura. But do you have any suggestions on like, where someone might start, where we might look for like a list of different ways to communicate within our coalitions that we could use for live polling, or if you would suggest like facilitate that at your next monthly coalition meeting to kind of help get people started and how do we engage in those preferences?
Yeah, that's a great question. That's a big question. So I want to I want to see if I can touch on at least a couple parts of it. I mean, in some ways, how you layer the communication strategies might depend a lot on capacity, and resources. So, what do you have a budget for, and what do you have team capacity to accomplish? I think the nice thing about Aspire is like we did have funding, so we had funding for in-person meetings. That was great. And that was an expensive thing to do. But it was just one piece, and I think there were other pieces that we could really, things that we could do that were manageable in terms of time and cost. I think, I think email is huge because I think everyone's on email. And I think it's a great way to reach people. I think we used it in multiple ways. We had, the e-newsletter that went out, but Maggie also did a lot of email communication with, one-off email communication with CAB members. And I think, frequency when it comes to that is important. So trying to make sure that there's this frequent, continual communication that people can count on and look forward to and anticipate. And, you know, one thing we found over the course of the project was that, you know, CAB members would reach out because they knew they knew the e-news was going to come out again soon. And they might have something to share that they could, you know, that they would offer for us to include, which was great. In terms of the live polling specifically, like we started out using, you know, a software called Poll Everywhere, but now Zoom has live polling integrated. We've also used Mentimeter, so we've used a couple of different tools. And the first time we used it, it was like, I want to say it was like 2019, and it felt like really new, and it felt really new and cool, you know. And I think was great because you know, we had a lot of we had some CAB members who were very vocal, and we would know that they would always have something to say and answer questions and pose questions, and others who were more on the quiet side, but we were able to capture their feedback through live polling, where we could get everybody, you know, where everybody could comfortably contribute. I don't know if that's answering your question, but
No,
that's a start. Maggie or Zara, do you have anything to add to that?
I would just
Or if I
echo.
missed a portion of it, Helen, please, you know,
no, that was
please
great. That was great.
restate.
Go ahead, Zara.
Yeah, I would just echo what you said, Laura, about having, you know, different channels and different ways for people to reach out. Is not, I mean, that sort of goes back to the knowledge point of like coalition members, like knowing, you know, that you may have some coalitions who are, you know, very like comfortable speaking up in meetings, no matter how large they are, and some may prefer to like send email feedback or respond to a live poll or something like that. So I think it's sort of a combination of knowing about like ways to communicate with the group and also like ways to communicate with your specific members.
And then I just have one follow-up question. You talked about the private message board and how that was something that people said they wanted, and then it didn't quite get the usage that you thought it might. How, like, what was the process in sort of deciding, okay, this is like, you know, we waited 6 months, or we waited, you know, only 25% of people are using it, or like, what kind of ways did you assess that maybe this isn't the right?
Yeah, that's a really good question. And also, I will share that we surveyed about even putting the tool, even developing the tool before doing it. That was one of our first questions at our first convening was, you know, what can we do? What do you all think is, you know, is there something that we can do from our team to help facilitate communication among this group? So we did ask, and there was interest. And you know, I think I think we continued to kind of promote it and kind of adapt our strategies for promoting it and sharing about it to make sure, you know, over a period of probably 6 months, maybe up to 1 year. And there was just a point at which it was clear that that wasn't how folks were communicating, and we were getting a lot of just communication through regular, you know, Outlook emails, and during the group, you know, during the twice a year webinars as well. So at some point we just we kind of picked up other priorities and continued kind of put our team's efforts into like beefing up the channels that people were using. So
Wonderful. Thank you so much.
yeah.
I think you should have one more slide, right? Next slide.
Yes.
Perfect. So as we conclude the webinar, just a big thank you to the three of you, Zara, Laura, and Maggie, for sharing your work and insights. And then also thank you to all of you webinar attendees for your participation. The next series in this webinar will be in August, and we'll focus on the policy competencies. So be on the lookout for an email containing the next webinar's date and registration link. I see your question, Jim. Yes, the follow-up email will go out with the recording, slides, and then the evaluation link so you can get your letter of attendance. If you have any questions about today's session or where to find internal communication at CADCA, you can email my colleague Abby at anls@cadca.org or myself at kshalter@cadca.org. And thank you all for joining us today, and we hope you have a great rest of your day. And thank you again to you, Laura and Zara and Maggie.
Thanks so much.